Hello, everyone, and welcome to our presentation on late-onset autism. My name is Jhanelle N, and this is Taylor C. Line, and we are going to dive into our presentation. Next slide, please. All right, this is just a brief overview of everything that we'll be covering in this presentation. First, we're going to go over our project goals, description of the diagnosis, significance of the condition, methodology of the project, significant findings, AI tools and applications used in this process, public health implications, and clinical and practical recommendations. Next slide, please. All right, now we're going to discuss our project goals. So the first goal of this project is to define what autism spectrum disorder is, then identify different factors that lead to delayed diagnosis slash late onset of autism disorder. Next, we're going to use different literatures to address different concerns due to delayed diagnosis slash late onset of autism. Next, we're going to identify the effects of the disorder in terms of individual and public health. Then we're going to identify how AI can be used to address autism disorder. Next slide, please. So this is just a brief overview of what autism spectrum disorder is. So autism spectrum disorder is a neurodevelopmental condition that affects how individuals interact, communicate, and perceive everyone around them. So typically this disorder is typically diagnosed in early childhood. But as we're seeing here in this project that we're diving into, we're mainly focusing on how it is noticed later in adulthood slash diagnosed later in adulthood slash late onset. And then here we just have a few images that different criterias that can be used to diagnose this disorder. Next slide, please. Now we're going to talk about the significance of the condition. So delayed diagnosis of autism spectrum disorder affects how individuals function throughout their life. Throughout their life, they go through wondering, like, why am I unable to interact how others are? Why are my communication skills a little bit underdeveloped than others? So with delayed diagnosis, individuals later have a better understanding of the lifelong struggles that they've faced. Many individuals that are diagnosed later in life slash have late onset of disorder find some type of relief in the diagnosis because they are able to understand why this occurred to them when they were younger or how they went about life. So the life of individuals improve after the diagnosis because they learn more about who they are as a person and how certain things were affected by the disorder. Next slide, please. Now we're going to discuss the methods used within this presentation. So to dive into this topic, we reviewed different peer-reviewed journals, newspaper articles, government reports to identify different elements associated with delayed autism spectrum disorder and delayed diagnosis and late onset. So peer-reviewed journals that we looked at collected information through surveys, observational studies, existing data, and individual interviews and focus groups. The newspaper articles that we used for this project dived into individual stories and learned about delayed diagnosis through existing data. And then lastly, we also use government reports, which just use existing data from previous studies and peer-reviewed journals. Next slide.
Yeah, thank you so much, Janelle. So, a radical shift in how autism spectrum disorder is understood highlights the lifelong impact of uncovering one's neurological identity as an adult. Earlier diagnosis and intervention are strongly associated with improved long term outcomes, yet, many individuals face significant delays in accessing accurate assessments. Research consistently demonstrates that late diagnosis can negatively affect daily functioning and independence, often accompanied by chronic stress and co occurring psychiatric conditions. In many cases, ASD is initially overshadowed by other developmental diagnoses, further delaying appropriate support. The emotional burden extends to families, with parents experiencing heightened stress, particularly when comorbidities are present, as well as a painstakingly slow response to treatment, even with clinical support, showing that outcomes can be incredibly difficult to shift. For individuals, receiving a diagnosis later in life often brings a complex emotional response characterized by both relief and grief. While diagnosis can provide clarity and allow for reinterpretation of past experiences, it may also prompt reflection on missed opportunities for earlier support. The literature also highlights significant gender disparities. Males are diagnosed at higher rates and typically earlier in life, while many females are not diagnosed until adulthood. Importantly, this discrepancy is not due to milder symptom presentations in females. In some cases, clinical assessments have actually revealed symptoms may be more pronounced in females. So, if women are experiencing higher levels of symptoms, how are they slipping through the cracks? This gap is partially explained by masking, a behavioral adaptation in which individuals, particularly females, suppress or mimic behaviors to align with neurotypical expectations, often resulting in substantial mental exhaustion. These findings point to a dual challenge: limitations in historically biased diagnostic tools and the adaptive behaviors that conceal symptom recognition. Together, they suggest a systemic gap in accurately identifying ASD across diverse populations. So, telehealth is becoming a crucial bridge as it massively increases support for those without nearby specialists. But then, are we approaching a future where telehealth just speeds up diagnosis for the privileged while leaving others behind? These tools must be welded with an understanding of intersectional barriers to truly work. So, artificial intelligence has exhibited advancements within this field through increased rates of earlier intervention and enhanced outcomes for ASD diagnosed individuals, though there are still relevant concerns in weighing that human clinical judgment throughout the diagnostic process, as well as AI programs evaluated not showing 100% accuracy, with limitations in fully accounting for various sociodemographic influences on diagnostic onset and progression. So, why does a massive shift in how we understand neurodivergence matter so much for those even without an ASD diagnosis? This is really about basic health literacy for the modern world. Despite increased societal awareness, late diagnoses remain widespread. This contradiction reflects diagnostic symptoms that are inconsistent and struggling to keep pace with our evolving understanding of the autism spectrum. So, fluctuation in presentation, particularly across gender, combined with the persistent cultural stereotypes, continues to hinder accurate identification and access to care. So current systems often fall short. Children are misdiagnosed, overlooked, females are underidentified due to cognitive demands of masking behaviors, and early signs such as developmental regression are sometimes dismissed. So these gaps do not resolve with age. Autism is a lifelong course, yet support systems remain disproportionately focused on early childhood, leaving autistic adults and seniors significantly underserved. So, numerous studies have pointed to stigma as a consistent barrier to care. And health literacy is not just a prerequisite for physicians, it's a requirement for the public. Heightened awareness quells stigma, empowers self advocacy, and supports informed healthcare decisions. When we push for an accurate, holistic understanding of neurodiversity, we aren't just aiding those with autism, we're encouraging the healthcare system to become more robust, more empathetic, and more precise for everyone. That's the ultimate public health implication: a healthcare system that is observant enough to listen to a parent about early neurological regression, nuanced enough to recognize the immense cognitive load of masking in a young woman, and adaptable enough to accommodate the sensory needs of an 80-year-old. We want things to be simple, but neurodevelopment isn't a one size fits all scenario. ASD, first formally recognized in the diagnostic manuals in 1980, underwent significant refinement with expanded criteria introduced in 2013. For many years, limited diagnostic tools hindered the accurate identification of ASD specific features. This update revealed a prevalence in older adults, challenging earlier assumptions that it was confined primarily to early childhood. Historical conceptualizations contributed to widespread misconceptions, which in turn delayed accurate diagnoses. ASD has frequently been misinterpreted or overshadowed by co occurring conditions, including presentations and overlap with psychotic symptoms. So, this complexity underscores the limitations of those checklist based approaches and highlights the need for more nuanced clinical assessments. Current literature identifies significant gaps in research and assessment methodologies, emphasizing the importance of reducing bias and improving clinician awareness of comorbidities. Without this, there is a risk of hasty and inappropriate interventions that may even exacerbate symptoms. So, improving that diagnostic accuracy enables earlier, equitable intervention and more effective long term management, essentially increasing ASD prevalence as earlier detection helps to demystify the process. When it's not this frightening, stigmatized matter, it allows for personalized acceptance and an opportunity to seek out support and a diagnosis as opposed to hiding from it. So, synthesizing the core message here, healthcare must adapt by shifting away from traditional ways of thought towards true person centered treatment that acknowledges lived experiences across the entire lifespan. Thank you for listening, and here are our references.